Hi, Michelle here. Now that you registered for the program and you got the password and you downloaded the study guide, you'll notice that you have on the top of your packet the zombie notes. So I just wanted to tell you about the zombie notes and how to use them to study for the program. The one I have here is for the Pediatric Advanced Life Support program. So if that's the class you're taking, you'll notice that the front of the guide has a lot of topics delineated throughout the page. It talks about the A, B, C, D's, and E's, and all the topics on here, especially the A, B, C, D, and E, are derived from, not only information from the textbook, but from questions that are on the PALS exam. So this study guide is really, I built this so it enables you to pass the ACLS and PALS and CPR exams a lot easier, because you're able to memorize the important facts about caring for these patients. So on the PALS study guide, we took things from the textbook, we took ideas from the exam and placed it on here for you. I also took concepts from the PALS program, which is kind of like a step under the PALS certification program, but it has some new terminology in it. So the PALS class stands for Pediatric Emergency Assessment, Recognition, and Stabilization. But there are terms on here that helps us with that as well. It talks about exposure, the A, B, C, D, and E, and these are the things that affect the children. There's a topic on trauma, shock. These are the important parts in critically ill children. It also goes through algorithms, whether it's SVT or VT, bradycardia, tachycardia. It talks about how to treat it, the steps in treating it, the medications, the doses, and in the pediatric world, everything is by weight. So it helps guide you in dealing with drugs and doses by weight. It has all the algorithms on here, condensed to make it easy for us to remember. And I've always found that very helpful in making us really gear into the topic and be able to pass the program much easier. On the back of the form, it really breaks down into different charts, explaining to us, from the different age groups, infant, even neonate, and into the children, the differences in the CPR. It talks about the difference in their respiratory rate, their heart rate, what to expect in different age groups, what blood pressures to expect, what is, normal, low normal. It talks about different types of equipment, endotracheal tube size, cuffed, uncuffed, based on weight and size. And there's other tidbits on here. So all in all, the study guide is geared to help you pass the program. And if you had any question about any of the content or any questions that you have about the programs, you know that you can contact me anytime. You might already have my phone number, or from my website, you can email me, and that's michelekunz.com. I think everybody knows that. So if you have the study guide, really use it to your best before coming to the class, and it makes the class go much smoother for all of us. If you don't have the study guide, like if you're not able to register for my program, it's easy to get one on Amazon.com. Thank you for your time.